I welcome each one of you from our SKDC Diabetes Center, Pune. So, someone has diabetes, we know there are complications. On the top of it, someone has blood pressure, there are additional complications. So, what do you think? 2 plus 2, is it 4 times high? No. It is 6 or 8 times higher the risk for our heart, for our kidney, for our brain. So, these two things together is not a very good thing. So, high blood pressure with diabetes is not a good combination. It's not good to have both things together. But you can see that when it increases, the problems of the heart, problems of the kidney, that is small arteries, problem of the peripheral vessels, the arteries, and of course the brain. So what happens with blood pressure? As the blood pressure rises, all our arteries face that blood pressure, feel that blood pressure. They become hard, they become thick, their elasticity goes down, they are not compliant. So all arteries in the body, they become stiff. These stiff arteries create problems for our kidney, for our brain, for our heart, everywhere. At the same time, our heart works against this high blood pressure. It has to pump against the pressure. So heart also suffers. So together this blood pressure and diabetes, it's not good for the major 4 organs, heart problems, brain problems, kidney problems, as well as the small arteries. So please understand that that is the importance when the two things are together if someone has diabetes along with blood pressure. So we all always say these are the complications of diabetes, like eye problems, kidney, heart, peripheral nerves. All these problems mainly happen because of the choking of blood vessels. You can see here the blood vessels are not clean, they get choked. This choking increases many-fold if someone has also high blood pressure. So what happens? Blood pressure increases all the complications in diabetes by many-fold. That's what I was discussing. Here comes the importance of controlling blood pressure in each and every one of case. Like this is a very good scientific study called as TNO2 diabetes study. What it did in type 2 diabetes people, like diabetes which everyone has, it was controlled blood pressure, HbA1c, that is sugar, and third was cholesterol. And the other group was a normal control. One group was very strict control. What happened? Patients who had a very good control, you can see it is called as intensive therapy, they had a very low risk of all the complications compared to not a very good control. So once we have diabetes, it is very important to control all these 3 problems which I just described, A, B, C. It's very easy to remember. A is A1C, that is your HbA1c, which should be how much? Below 7%. B is blood pressure, it should be below 130/80 or up to 130/80. Then C is cholesterol, where your LDL cholesterol should be below 100. If it is below 70, it is far better, but at least below 100. LDL cholesterol. So these 3 things, A, B and C, if they are under control, then we say our diabetes is under control. Now if the benefits of blood pressure, out of all these 3, which gives us maximum benefit to prevent heart attacks or brain attacks? You will always say sugar because we have diabetes. Actually, no. The major benefit comes from blood pressure control. Major. So if we have a blood pressure control, we have more than 50% problem is solved. So remaining problem solved, we need to control our cholesterol and the sugar. But blood pressure control gives us maximum benefit. And it's very easy to control blood pressure. You have to just take one tablets or one pill and do some lifestyle changes. It's not as difficult as sugar control. So always remember, benefits of blood pressure control are far, far more, and they are very important. So if we have blood pressure very good control, maybe 1 pill or 1.5 pill or maybe sometimes 2 pills for blood pressure, when it is controlled, it reduces heart problems, kidney problems and brain problems, which is, I will say, like all the problems of diabetes related issues, more than 50% are just controlled because we have a good blood pressure control. So it is very, very important to have a good control of blood pressure. So what's the take home message from my first point? That if someone has diabetes and a blood pressure, a good blood pressure control gives benefit to heart, kidney and brain. So all cardiovascular problems are absolutely under control. Please remember this.